So you have stress urinary incontinence and you're thinking about sling. Let's talk about different types of sling and why I prefer one over another. So sling is a gold standard procedure for treatment of stress urinary incontinence, leakage of urine with physical activities such as sneezing, coughing, laughing, jumping. So sling is a surgical procedure that's done in operating room. And there are two main different types, synthetic and autologous. What it means is one is made out of synthetic material and another one is made out of your own tissue. So you might feel like having a sling made out of your own tissue is significantly better. However, there are pros and cons to both of them. So let's talk about it. So synthetic sling, this is a small piece of synthetic urethral sling, and there are different types. Some that has a little bit more synthetic material, a little less, but the idea is the same. These slings are usually placed with a small incision under the urethra where we place the sling kind of like a hammock underneath your urethra, the tube through which you pee, and it supports the urethra, so anytime you cough or sneeze, the urethra remains closed. Synthetic material sometimes refers to as mesh, and you might have heard that mesh should not be used. But just to clarify, that mesh was used for repair of pelvic organ prolapse and since then was taken off the market. This particular material is used for treatment of stress urinary incontinence, considered to be safe and considered to be gold standard treatment for the stress incontinence. There are different types of synthetic slings depending on the surgical approach, such as retropubic, obturator sling. They all have the same idea in mind, that they support the urethra and prevent urinary incontinence. The good thing about synthetic slings, it's very quick procedure. It takes about half an hour to perform and you go home in the same day. And the only limitation is not lifting heavy things and not having sex for about 4 weeks until the suture's healing. Synthetic sling is very durable. According to studies, at 15 years, about 98% of women are still very happy with their sling and don't experience stress urinary incontinence. Obviously, nothing is 100% guaranteed. Possible reasons that would require replacement of the sling are if woman gains a lot of weight or lose a lot of weight, or if she would have a vaginal delivery. It's possible that the sling would not work as well. Some cons of using synthetic sling is in some cases, usually in women who has a severe vaginal atrophy or smokers, piece of the synthetic material can be exposed through the tissue, kind of erode through, and be visible or cause some bleeding or discomfort. In those cases, you can usually treat that with the use of vaginal estrogen, or if the large area is exposed, you can excise it in the office and still use the vaginal estrogen to heal it. And some patient ask me, would I reject the sling since it's a foreign material? Well, not really, because there is no proteins in that synthetic material. So develop allergic reaction and rejecting the sling is very unlikely. Now let's talk about autologous sling. So autologous sling made out of your own tissue, and that tissue needs to be harvested. You can harvest it through your leg or from your stomach. It's usually a piece of the fascia that will create the body of the sling that we will place underneath the urethra. So you can already hear how it's a little bit more involved surgery compared to the synthetic sling. Usually it takes a few hours to harvest the fascia, to close the area where you harvest the fascia, create that sling, make incision in your vagina under the urethra to place that newly created sling. And you can think about it as two surgeries that needs to take place. One is the harvest of the fascia, and another surgery is actual sling placement. Usually women stay at least overnight after that procedure. When you go home, it's a significantly longer recovery. If the fascia was harvested from your leg, it's about like a few months you can't really exercise or run or do the physical activities that you enjoy. And if the sling harvest from your abdomen, from your stomach, the recovery is very similar from the C-section and incision and takes a few weeks to months to recover. The only real preference to have an autologous sling is if you don't want to have any synthetic material in your body. However, there are several drawbacks that have to be addressed. First, it's significantly bigger surgery that requires significantly longer recovery. So another drawbacks is because autologous sling is made out of your own tissue, it's more prone to stretch and cause the recurrence of incontinence. And also, because it's a little bit harder to position and adjust it during the surgery, it can cause higher risk of urinary retention, meaning difficulty with voiding. So if you have a stress urinary incontinence, there are multiple options to treat this condition. Sling is one of them, and there are different options for the urethral sling. So it would be me, I would go with the synthetic sling because it's a smaller surgery, faster recovery, longer durability, and less complications and side effects. But no matter what preferences you have, we can always find the option that would work for you in your lifestyle.